So our today's topic is overview of biomedical waste management, right? So in this subject, we will discuss what is biomedical waste management and what are the principles and importance to manage this biomedical waste. And then we will discuss the categories of the biomedical waste, right? So there are many categories. We will discuss them one by one. Then in the unit 3, there is color coding. So in the color coding, we will understand about in which type of color dustbin we have to put our wastage, right? So we will segregate our waste and then we will dispose it. Okay. Then in the fourth unit, we will discuss the safety measures. Where we will discuss about the in the operation theater, what type of safety measures we have to take, and what type of and about the sterilization techniques we will discuss. What type of sterilization techniques are there, and what are the importance of the sterilization. So all these things we are going to discuss here in this subject. So students, if you will be having any doubt after the class, you can ask in the chat box. I will answer all the questions. Okay, and even in between also, if you will be having any doubt regarding today's class, you can write in the chat box. So let's start the class now. So first of all, biomedical waste, right? So biomedical waste is also known as BMW, as it donates BMW, right? Biomedical waste. So basically, what is the biomedical waste? So waste is which we get from the hospitals, from right, from the laboratories or from the any research activities somewhere it is going on. So from there, the whatever waste we have that is known as the biomedical waste, right? So in the biomedical waste there can be many types like the diagnosis, the treatment of the immunization of the human beings, right? Animal waste can be there, research activities or pertaining there to or in the production or testing of the biological or the health camps, and the categories mentioned in the schedule 1. So even there are many schedules, right? In that categories are mentioned in this biomedical waste. So right, so here we will discuss there are rules that are applicable for so hospital. Basically this biomedical waste, the waste is which is biomedical waste. So to manage this particular waste, in this there are many types of the waste: infectious waste, non-infectious waste, sharps will be there, and there will be laboratory waste, there will be research laboratories waste, different types of the waste will be there, right? So there is a rule, right? There are many rules to manage those wastes, right? So the rules are applicable for the hospitals if there is hospital waste for them, nursing homes, clinics, dispensaries, institutions. Veterinary institutions are the institutions where there will be animals, treatment of animals will be going on. Animal houses, right? For the experimental purpose, we have the animal house, right? From there also we can get the wastage, and these rules will be applicable on this pathological laboratories, blood banks, ayush hospitals, clinical establishments, research or educational institutes, and health camps, right? So these are some places, right? These are the some, right, where the rules are applicable, right? Medical or surgical camps, vaccination camps, of course there will be many type of biomedical waste, right? So you need to so you required uh, to manage those waste, right? So blood donation camps, first aid rooms of the schools, even there will be the wastage, and we cannot throw it like so simply. Okay, there is a rule to manage this waste. Forensic laboratories will be having biomedical waste, and research labs, right? So I hope this is clear to all of you where the rules will be applicable to manage the waste. Okay. So now we will discuss the types of the biomedical waste, right? कितने types के biomedical waste होते हैं हम उसके बारे में डिस्कस करेंगे. ठीक है. So this is the waste minimization hierarchy. Basically, there is a principle of biomedical waste management, right? So why it is there to manage the waste, right? To minimize the hierarchy of the waste, right? Because there will be many waste, right? हर जगह waste होगा, तो उसको minimize करने के लिए एक rule होगा, right? There will be some rule किस type का waste कहाँ पे आपको डालना है, dispose करना है, right? So you can see here source prevention and reduction, reuse, recycle and compost. हम ये भी कर सकते हैं, treat कर सकते हैं waste को, and then we will dispose them. So right, so now there are types of biomedical wastes. तो यहाँ पे waste की categories हैं and there are types of the waste. So it is very important to remember this. So first of all, before going on that, we will discuss the some types of the waste, right? So as I told you, there is infectious waste, there is sharps, pathological waste. तो infectious waste में कौन से waste आते हैं? कोई भी बायोमेडिकल वेस्ट विच इज इन्फेक्शियस और कंटामिनेटेड, राइट? वो कंटामिनेटेड होगा, राइट? इट कैन स्प्रेड द डिजीजेस फ्रॉम वन पर्सन टू अनदर एंड फ्रॉम द एनवायरमेंट, राइट? तो that is why it is important to dispose them dispose them nicely, okay? And there will be sharps. In the sharps there will it is include the needles, and needles will be there, and some scales, broken glasses, razors, all these things will be coming in the sharps. Then coming on the pathological waste, so basically in the pathological waste there will be the body parts of the human, okay? The human के जो भी body parts होंगे include the tissue, fluids, right, and एनी बॉडी ऑर्गन्स. सो ये सारी चीजें किस में आती है? एनाटॉमिकल वेस्ट में बोलते हैं हम इसको, मतलब राइट, पैथोलॉजिकल वेस्ट बोलेंगे, ठीक है? पैथोलॉजिकल वेस्ट, उसमें ये सारी चीजें इंक्लूड. देन कमिंग ऑन द फार्मास्यूटिकल वेस्ट, तो फार्मास्यूटिकल वेस्ट में आपकी मेडिसिन आ जाएगी, राइट? एंड जो ड्रग्स, क्रीम्स होगी जो एक्सपायर हो गए, वो सारे इसमें आ जाएंगे. देन कमिंग ऑन द जीनोटॉक्सिक वेस्ट, तो उसमें टॉक्सिक ड्रग्स होते हैं और हजार्डियस टॉक्सिक वेस्ट होते हैं जो कि टॉक्सिक होते हैं, राइट, जहरीले होते हैं. एंड फिर केमिकल वेस्ट में आप लोगों को पता है कुछ बैरियर्स आएंगे, कुछ केमिकल्स आ जाएंगे, डिसइंफेक्टेंट्स आ सकते हैं, वो भी केमिकल होता है. और जनरल वेस्ट में कौन से होते हैं? जितने भी नॉन हजार्डियस वेस्ट है, मतलब जो मेडिकल रिलेटेड नहीं है, नॉर्मल वेस्ट हो जाते हैं, राइट, वो नॉन हजार्डियस वेस्ट हो जाएंगे. ओके स्टूडेंट्स, आई होप क्लियर टू ऑल ऑफ यू. नाउ types of biomedical waste में there is category 1. So in the category 1 there is human anatomical waste which is a pathological waste. As I told you, animal waste, human anatomical, these will be coming in the pathological waste. And in the category number 2 there will be coming the animal waste. Animals waste will be coming in the category 2, right? So in this if it is a veterinary hospital, veterinary institution, so there will be many animal wastes, right? So you can collect them from there. And the category number 3, there is the microbiology and biotechnology waste. Means if there is any research going on something, right? So if there is the cultures of the bacteria, viruses, right? And so these kind of wastes will be coming in the category number 3. Now coming on the category number 4. So in the category number 4, there will be the sharps. Okay, sharps will be coming in the category number 4. And in the category number 5, there is the discarded medicine and the cytotoxic drugs, right? So medicines which is discarded means pharmaceutical waste is there. Then category number 6 and 7, both are containing some solid waste. And category number 8 is containing the liquid waste. All the liquid waste will be coming in this category. Now, in the category number 5, incineration ash, मतलब जो waste आपने जलाया, right? वो जो remaining product उसका निकल रहा है, ash, incineration ash, it will be coming in the category number 9. Okay, students. In the category number 10, there is a chemical waste. Okay, chemical waste will be coming in the category number 10. Now, coming on the BMW management processes. So here you can see from the hospitals is it will go in the in-house segregation. तो first of all कैसे process होता है, कैसे हम waste को manage करते हैं, तो one by one there is a step. सबसे पहले hospital से जब waste आता है, right, it is coming, then what will happen, it will be in the in-house segregation, right? In the so there will be segregation of the waste, type of the waste they will segregate it, right, they will separate it. Then there is a common storage room. Okay, so there is a common storage room, common storage point for them. Then they will transport it. The wastes will be transport wherever they want, they need to be transported. Then they will uploading and temperature storage at the CBWTF. So एक particular temperature storage पे इन्हें store किया जाएगा, upload किया जाएगा सारे waste को, and then we will give them the treatment. So there are some wastes which require the sterilization, disinfectants, so that they cannot spread the diseases to the environment. And from the environment, we will get the diseases, right? So that is why the treatment is important. They will just treat the waste according to their need. Like which type of waste can be treated, which type of the treatment they should give to the waste. As you can take the example, if it is the animal waste, so insertion method you can do, digging and all you can do for the anatomical wastes, right? They should treat it nicely because they will otherwise they will destroy, and anatomical waste will give the foul smell also, right? And many microorganisms will grow on that. So that is why it is important to manage those these wastes, right? And then coming on the sharps, so they should make sure the needle is not be in a simple container. It should be a hard thick, so that anything cannot come out and it can it can affect to someone, right? So वो needle किसी को लग सकता है, and then it will be like chances to get the different types of this diseases also. So that is why it is important first to autoclave them, so that the microorganisms anything will be present on the waste, so it will be destroyed, right? And then they will treat it, then they will dispose it, right? So after the treatment only they will dispose the waste. It is not like that they will segregate the anatomical waste and the pharmaceutical waste and all the pathological or chemical waste they will segregate and simply they will dispose it. It is never like that. Okay, first after segregating it is very important to treat the waste. Whatever is the requirement of the treatment of the waste, it should be required, it should be given the particular treatment. Okay, so now coming on the categories and the classification here. So in the hospital, here we will discuss. So this is the biomedical waste management rules are there. So according to their rule, biomedical wastes are divided here. The yellow, red and white, blue containers are there. Okay, so we will discuss them in depth. Here the general waste are there, where some wet waste will be there, dry waste or construction and demolition works. So first we will come on the biomedical waste. So first we will be studying about the yellow waste. So please listen it to the listen carefully. After the class, I will ask you the question. So I hope you will answer the question. Okay. So coming on the yellow waste, what happens in the yellow waste? In there is a yellow, red, and white container. So in the yellow containers, so there will be human and anatomical waste. So whatever the waste will be, whether it is solid waste, right? So it will be coming in the yellow one. Okay. And right, and solid waste, expired or discarded medicines, chemical waste, chemical liquid, discarding linens and materials, and biological other wastes. So even they are there. Okay, so all these will be coming in the yellow waste. Now, so in the yellow box. Okay, so human anatomical waste will be coming in the yellow. Okay, whether it is solid. Now, coming on the red, contamination. Basically, they have given there are many types of the waste, microbiology, laboratory, but in the yellow, the human tissues, body fleshes, all these will become in the yellow. Coming on the red one, so in the red one, there is the contaminated plastic waste. Okay, contaminated plastic waste will be there. Whatever the waste is contaminated, they will be in the red one. And in the white one, there is the waste sharps, including metals. So these will be coming in the white, where the sharps and metals will become. And the blue one, there is the metallic body implant, right? And the glassware. So glasswares and metallic body implant will be coming in the blue one. Okay. So here you can see in the yellow one, human and anatomical, and these type of the waste is also will be coming in the yellow in the different containers. Okay, and there will be the labeling, proper labeling will be there, like which waste is in this container, right? So labeling should be there. And now, coming on the general waste. So here the wet waste, dry waste, and construction. And construction, if there is construction in the department, in the hospital, so all the wastes will be coming here in the general waste, right? So there will be label on the container which type of waste is there. Okay, now here you can understand nicely. So all the infectious waste like bandages, cottons, body parts, and the placenta will be dispose in the yellow one. And in the red one, any infected dressing, pop, cast, they will be in the red one. Glove, syringe, and plastic waste will be in the blue one. And in the black is there for the drugs, right? It will be in the black one, and for the needles and cut glasses will be the white one, right? I hope this is clear. Now here, type 1 container, non-chlorinated plastic. This is a non-chlorinated plastic bags. Okay. So here you can see, as in the first one also we discussed ki which type of the waste we will keep here. So human anatomical waste, and solid waste, expired or discarded medicine, chemical, biotechnological waste, chemical liquid. एंड द ट्रीटमेंट कैसी मिलनी चाहिए इन वेस्ट को, ट्रीटमेंट जो मिलेगी, इंसिनरेशन फॉर दिस, और राइट, फॉर दिस ह्यूमन एनाटॉमिकल और एनिमल एनाटॉमिकल वेस्ट के लिए पायरोलाइसिस और डीप ब्रूअल, डिगिंग करके भी ये सारे वेस्ट अंदर डाल सकते हैं, देन दे विल डिग्रीगेट, और एल्स इन जला सकते हैं इन वेस्ट को, राइट? सो दिस टाइप ऑफ ट्रीटमेंट वी कैन गिव देम. नाउ non-chlorinated waste bags or the containers will be in the red one. So here the contaminated waste, इसको हम recycle करते हैं, इसमें प्लास्टिक वगैरह भी आ जाता है, आपकी ट्यूबिंग बॉटल्स, इंट्रावीनस ट्यूब्स, कैथीटर्स, यूरिन बैग्स, ग्लव्स आ जाएंगे, सेट्स, और आप कुछ फर्स्ट एड चीजें भी इसमें डाल सकते हैं. ऑटोक्लेव करते हैं हम इनको, और माइक्रोवेव भी कर सकते हैं, हाइड्रोक्लेविंग भी कर सकते हैं, देन हम इसको रिसाइकल के लिए भेजते हैं, राइट? सो पहले हमने इसे ऑटोक्लेव क्यों किया, व्हाई इट इज रिक्वायर्ड टू गिव दिस ऑटोक्लेविंग, बिकॉज ऑटोक्लेव, माइक्रोवेविंग और हाइड्रोक्लेविंग, ऑल दीज थिंग्स can remove the microorganisms which is present on them, then they will be disinfected, they will be clean, and then they will they will transport to the for the recycling. Okay, now coming on the translucent. So here translucent puncture or leak, any waste which can leak, tamper, so it should be in a tamper proof containers, right? So this container is translucent, puncture proof, leakage proof, मतलब ये कोई लीक नहीं होना चाहिए, एंड टेम्पर प्रूफ होना चाहिए. ऐसे कंटेनर्स में कौन से वेस्ट होते हैं? शार्प वेस्ट और मेटल वेस्ट, राइट? So for that wasted, what kind of treatment should be given? It is the auto or dry heat we can give, sterilization we can give them, shedding or the multilation or the encapsulation. So these kind of treatment we will give to these sharps waste, right? Wasted which are sharps or metals and all. And for the glasswares, we use the cardboard boxes with blue color marking, right? So their marking will be blue color. And here disinfection on autoclaving will give, microwaving, hydroclaving, and then we will send them for the recycling process. So these are the types of the treatment we provide to the waste before the disposing, or before sending to them to the sending them to recycling. Okay. So all these kind of treatment we give to our waste, right? Now, role of healthcare facility. आपकी जो हेल्थ केयर फैसिलिटी है उनका क्या रोल होता है इसमें? सो दे विल मेक अ प्रोविजन विद द परमिसेस फॉर अ सेफ एंड वेंटिलेटेड एंड सिक्योर्ड लोकेशन फॉर द स्टोरेज ऑफ segregated BMW in color coded bags, right? So it is given in the schedule 1 key. It is their work to get they want a secured location for the storage of their segregated waste, right? Because it is very important to get the particular location, because these wastes can harm to the environment, right? So for the environment safety it is important step. And to pre-treat the laboratory waste, microbial waste, blood sample, blood bags through the disinfection or the sterilization on site as per the WHO guidelines. So we should give them a safe management of safe management of waste from healthcare activities, and WHO Blue Book is there. They have also mentioned these things. Okay. Now, next is the to phase out the use of chlorinated plastic bags and the gloves. So we should always use the chlorinated plastic bags or the gloves, as we discussed in the previous slide. And here the disposal of other solid waste in the accordance with the permissions of the respective waste management. Okay, rules are there. And we should never mix the biomedical waste with the municipal waste. It should not we should never do this, right? Because we have to it should be segregated, because they're transporting other places for the treatment or for the disposal, right? So if will be mixed, then it will be problem, right? And provide the training to all the health workers. It is very important to provide the training to the health workers or regarding the handling of the waste management, right? So these are some points which is a role of healthcare facility, what they should keep in their minds, right? And they should always immunize all its healthcare workers and other involving of biomedical waste, right? So क्या होता है कि इन लोगों को, जो भी लोग biomedical waste workers हैं, who are the handlers of biomedical waste, they should be immunized. उनको सारे vaccinations लगे होने चाहिए, so that they will not get the diseases, right? Because they are dealing with the infectious and non-infectious wastage, so they can there is the chances of to spread the diseases, right? So establish or a barcode system should be there on the bags, on the containers which is containing the biomedical waste. So there should be a scanning system, so that they can barcode के साथ होना चाहिए, so that they can scan the particular barcode. Okay. So and the next is the ensure the segregation of liquid chemical waste. And there should always be a segregated liquid chemical wastage as the source, and ensure pre-treatment or neutralization prior to the mixing with another effluent, right? So it is very important to ensure that the wastes are segregated or not. Liquid and chemical waste are there, right, as a source. So they should be segregated. It should not be mixed, right? And then we will give them a pre-treatment or neutralization, right? And here the it is very important to ensure the treatment and disposal of liquid waste, right, according with the water. And ensure the occupational safety. Occupational safety ensure करना बहुत important होता है by providing the appropriate and adequate personal protective equipments, right? So personal protective equipments provide किए जाते हैं. We will discuss them also, so that it will be clear to you. Now, conduct the health worker checkup, and there should be a regular health care checkup of the workers who are working to maintain this wastage, right? And there should always the record maintenance should be there, right? Records are very important. So for the health workers, so उनका जो भी चेकअप होता है उसका रिकॉर्ड मेंटेन होना, इट इज मैंडेटरी, इट इज इम्पोर्टेंट, ओके। And also the care facilities, healthcare facilities is in place to maintain and update on day-to-day basis, right? The biomedical waste management register should be maintained day-to-day basis, and it should be displayed monthly record on its websites, right? And their work is to report the major accidents, right? Which including the accidents caused by the fire hazards, blast during handlings of the biomedical waste, if there is any blast, or the remedial action, if there is any remedial action have taken, then so the report should be there, right? And make available the annual report on the website by, right? So it is, there is some date for that. Um, when it was like there was date for that when they have ordered them. It should be like the record should be maintained on the website on the particular date. So there will be also some, this is the example, and many dates they will give a particular date. They should report their, they should report their work, right, on the websites and on the registers, all this. So I have just mentioned some dates so that it is keep in your to keep in your mind, right? कि यहाँ पे different different dates होते हैं, इसको like follow करना important होता है, right? So now coming on the inform the prescribed authority, which is JSPCB. So immediately हमें इन्हें inform करना चाहिए if there is any case the operator of the facility does not collect the biomedical waste within the intended time as per the agreed time, right? There will be an intended time, agreed time. But of course, there will be a time. If the waste is will be simply like that, whenever you are managing them, whenever it is not like that, right? There should be a particular time to manage the wastage. Now, coming on the establish a system to review and monitor the activities which is related to the biomedical waste management, right? Now, coming on the maintain all record for operation of incineration, hydro or autoclaving, etc., for a period of 5 years. So, it is important. Now, as we discussed, we will discuss the PPE kit. So here, the PPE kit, basically it is a personal protective equipment. So many of you have heard about this in the COVID-19, doctors were wearing the PPE kit, right? It is basically for the safety purpose. So they have the goggles, so they will protect them, protect their eyes, and there is a three-ply face mask is there, okay? And there is a gloves, pair of gloves they have wear, and cover all with hood. So there is a hood which will the hood will cover all their body, and there is a hazardous waste, right? Sorry, hazardous bag is there where they will collect their wastage, and then shoe cover is there which will cover their shoes. So basically, the PP is the personal protective equipment so that the workers should not get any type of the diseases, any kind of the diseases. So that is why wearing the PPE while working is very important. Okay, so it is about the PPE kit. Now, the next is the basically here this is some definition and terms for the sterilization. As we required the sterilization technique, right? The technique is required for the disinfecting and for cleaning, right? So here basically cleaning, what is this? The physical removal of the organic matter materials. So there will be some organic materials के help से हम physical removal करते हैं, right? From soil, from the objects, or usually we done using the water with without detergent. So this is the normal cleaning. But sterilization is when there is any form of the microbial growth, right? Microbials can grow anywhere. So when there will be the growth of the microorganisms, so to kill them, we need the sterilization. And sterilization are by different types of the methods: chemical method, physical method, mechanical methods, right? So there are different types of the sterilization. So it is as per the need we perform the particular method of sterilization. Okay. Now coming on the disinfectant. So basically it is defined as the intermediate measures between the physical cleaning and sterilization. And it is carried out with pasteurization or chemical germicides. So basically these cleaning, sterilization, disinfection, so these are the important as we are using many equipments, right? And we are sending the biomedical waste for recycling. So before recycling we should give them this kind of treatments, right? So that at the that time also we will get up sterilized equipments, right? So now basically, as in your syllabus, there is safety measures, right? So here there are some things about the OT. So pre-procedure check-in in pre-protective area of OT. So in the OT, we should always check the procedure, right? Surgery orders, imaging, blood test reports, everything. Is that okay or not, right? And brief all the teams should be identified. Who are they? And procedure side concerned, anesthetic review, surgeon review, all these things should be there. Time out before the skin. So critical or unexpected steps of surgery, case duration. So these will be coming here. Sign out patient leaves operating room. So counting of the sponge, sharps, instruments should be there. So there should be a particular counting. So now your how your OT should be like should be. So all the things should be clean, sterilized because the surgery will be happen in the OT and everything should be neat and clean. Even the curtains also should be clean in the OT and there is no one is allowed in the OT without the PPE. Okay, and it is not like that any staff can come in the OT, never, right? So particular staff can come in the OT, right? So these are some safety measures we should keep in our mind while working in OT, right? Or even in the any ward, anywhere we are working, so we should always wear the gloves, mask, right? Because any kind of infections can trap us. And also the environment should be clean in the hospital, right? So that the patients will not get any type of the infections. So here students we have discussed about the biomedical waste management. So what are the wastes and how we can manage them? All these things we have discussed in this class. So thank you so much. I hope the class is fruitful for you.